Hi, my name is Daniel Prang, and today we will be talking about the topic of meaningful use. To start off, what is meaningful use? Well, the definition I have is that the Health Information Technology for Economic and Clinical Health Act designated incentive payments to healthcare institutions nationwide to promote and cultivate health information technology and implement qualifying electronic health records. Through the use of electronic health records, healthcare providers are expected to be meaningful users and make significant improvements in healthcare. That's a very fancy way of saying that healthcare is basically going to a computerized online um, type system, and the government is promoting that. They gave payments, they're pushing, they want this for the future. Why do they want this, and why are we interested in this? Well, the first is to improve quality, safety, efficiency, and reduction of health inconsistencies. With meaningful use, if we all are on an electronic health record and we have information at our fingertips, we can more easily accomplish those things. A second goal is to engage patients and their family members to be active members of their healthcare. If everything is online through the use of patient portals and more open access for the patient to their medical record, they can be a bigger part of their healthcare. In the past, you would have to, for the patient to get their information, they would have to go to medical records, they would have to go to multiple different places. With meaningful use implemented, everything can be right there and they can easily access it. And the last reason that meaningful use is important is it increases healthcare coordination. Um, Different institutions, different your doctor may have one thing, the hospital may have another thing, you may have seen a specialist. With meaningful use, all of those different entities can share information in an easier and more timely fashion. So, how are we going to make that happen? Well, currently, the implementation of meaningful use is in three stages. As you can see by the little artwork there, it's not necessarily going to be easy. So, stage one began in 2011. That was the stage of data capturing and sharing. This was the point in time where data was being collected, patient charts were being scanned in, patient profiles were being built. Many hospitals and healthcare systems were switching to electronic health records, and basically they were building the system. Stage two, the deadline for that was 2014, and that involved a lot more advanced clinical processes. That was more focused on the exchange of that information between different entities. It was when they started pushing to build patient portals, improve patient access, and put patients more in control of their healthcare. Stage three was to be implemented in 2016. That's more of the focus of improved outcomes. That's what did we accomplish with the first two stages, and how can we make it better? It goes back to that statement of improving quality, safety, efficiency, and improving just outcomes as a whole. If patients have better access, if healthcare entities are able to share information more easily and more quickly, that will improve these outcomes. So, what are some considerations when it comes to the implementation and the use and meaningful use and its effectiveness? Well, the first is cost. All of the technology costs a lot of money. There's a lot of cost that was involved in, you know, building the patient's charts. There's costs involved for the patient. Uh, the greatest system in the world isn't any good if they don't have access to it. So you have to consider cost for them. Not everyone has a computer. Not everyone has a smartphone. That again um, goes into our next point, which is technology. Technology is great, and it's you know a super important part of of meaningful use and its effectiveness. But technology advances very quickly. Not everyone can keep up with that technology. The older generations have a hard time with things that are on the computer or things that are online. Also, cost of technology is high. Like I said, not everyone has a computer or a smartphone, and it may be because they can't afford it. That rolls into the next point: patient populations. You know, patient populations. Their problems go with really the first 2 points, the cost and the technology. Um, if you have an elderly man who was raised in a very poor household, never had a computer, never had access to those things, doesn't have any healthcare knowledge um, at baseline. He's relied on the provider just to tell him what was wrong his whole life. He never took any control of his healthcare. It's going to be really difficult for him, even with the best system in place, to really utilize it and make the most of it. The last consideration is interoperability, which is something we're going to cover here on the next slide. So what is interoperability? That is the exchange of data from one health information technology system to another with the ability of the recipient system to interpret the data. So as you remember, one of the first slides we talked about implementing electronic health records. Well, they're not all the same. There's multiple different ones. And each different one has different facets. Like I work in the emergency department, and the electronic health record, the portion that I use is very different from the inpatient portion that somebody else uses, or even like the outpatient doctor's office portion. And that's all within the same system, and there's multiple different systems. That little picture there just shows all the different things. It's a representation of what's happening and what we're trying to access and what we're trying to coordinate. And basically, how can we all just get along and, talk to each other, respect patient privacy, and make this effective. So what is Meaningful Use's contribution to practice? Well, when implemented, it increases access for the patient to their health record. The electronic health record now involves patient portals, patient access. A patient can leave the doctor's office, get online or get on their phone, and they can look at what was done, what they had, look at any diagnosis they were given. They can research those types of diagnosis and just be better informed. Secondly is better communication between healthcare facilities. Like I said, I work in the emergency room. Oftentimes we'll get people in who are out of state or on vacation, or they had a procedure done at this hospital because they went to see a specialist, and we can wait sometimes in the overnight, which is when I work. We can wait hours for patient charts and patient information. And during that time, we take the best care of a patient that we can, but the patient suffers because we don't have all the information we need to be able to take care of them. That rolls into the next point of improved ability to treat the whole patient. Oftentimes, like I said, a patient, if they're on vacation, they're going to come in and they will tell me, what their history is and what their medications are, but they may forget something. With, meaningful use and the interoperability and the access to their own health records, they can pull up their chart and they can show me, this is what I have, this is what I'm taking. If any of you have ever worked in healthcare, a majority of patients can't even pronounce the names of their medications. So this would greatly improve those type of scenarios. The last contribution would be decreased cost. Initially, we talked about cost and implementation costs, and those things are all very real. But once the system is in place, it's going to decrease the cost. It's going to save time. It's going to save money. The patient's going to be able to be more informed. The providers are going to be able to be more informed. We're going to be able to make more focused decisions and more personalized healthcare based on this access to information. So what do we see in the future? If meaningful use gets, interoperability, all of those things, we develop this flawless system. Everybody talks to each other. Everybody has access to their medical record. Patients become involved with their care. What does that mean? That basically puts healthcare at our fingertips. In the future, if everyone has their information, has their chart, on their phone, they can pull it up. It's going to enable us to provide competent and timely care in any facility. I could walk into a hospital across the country, show them my chart. They could immediately access my chart with my permission, pull it through, and know everything that I've ever had done, and from every facility that I've ever had done it. Every facility I've ever had it done in. And this is just going to enable patients to take control of their health care, not to be so reliant on the system for this doctor to talk, to see this specialist, to talk to this specialist, to get those records over there. This system will, allow those things to all work flawlessly and interact flawlessly, and it's going to be the best for everyone. The last slide here is just a little bit of humor. Hopefully this is not where we're at in the implementation process.